Hello. This is Dr. Yemi. I've been away for a week. I had an appointment last week, so I couldn't do the recording. So, like as I promised the last time, I'm going to talk about schizophrenia briefly, of course, because in order to really do a good justice, it will take longer time to actually talk about schizophrenia. Schizophrenia is a chronic, serious mental illness. It's one of the very debilitating mental health illness out there. Uh, develops gradually. Usually, it develops between the ages 15 to 25 or even to 30 or 35 in women. Uh, Usually, like I said, it develops gradually, and the symptoms, before it actually appears, like with psychosis, we have like phases of schizophrenia. We call the first one is called prodroma phase, which is like the patients or the individual will have milder symptoms, and usually it starts showing up at the age like you know early teens to late teens, like between ages 14, 15, 16. The patient, he notices in the individual that their schoolwork is lacking. They are having low grade in school. They are not as having social interaction with others like their peers, and they have memory impairments, and also they start to have this suspiciousness, suspecting people, thinking people are out to get them and things like that. How do we diagnose schizophrenia? Schizophrenia usually in terms of labs and MRI, CT, they do all that. Number one, they want to rule out if the person, when you have psychosis, like you're not in touch with reality, you want to find out if the person is under the influence of any drug. So they would do that. They would do MRI, CT scan to see the structure of the brain and all that. And at a point, for a diagnosis to be made, the patient will have to have like a psychotic symptoms such as hallucination, delusions, disorganized speech or thoughts, and that is severe enough to disrupt their normal work life, whether it be schoolwork or their family relationship, or disrupt their social interactions for them to be taken to the hospital. The next thing we're going to talk about is risk factors. What are the risk factors for schizophrenia? Number one is genetics, like it's in your genes. And other things are like neurobiological, like neurotransmitters in the brain, like GABA, dopamine. And they said if someone takes drugs like amphetamine, cocaine, can induce psychosis. But also almost any drug, especially marijuana, can increase the risk in someone who already has a biological vulnerability. So one of the things I always talk about is all these preventative measures like education about drugs. And I'm glad that in school district they talk about drugs. About drug. Preventing our children from using illicit drugs, street drugs, cocaine, marijuana, and things like that, because you don't know who is vulnerable. Anybody who already is vulnerable genetically can actually be thrown into having schizophrenia. So there are research out there about smoking weed when you are like late teens can develop schizophrenia early 20s and things like that. So other risk factors include brain structure abnormalities, which can cause disruption in communication between the brain. And other things are like psychological and environmental factors like biological, like during there's all kinds of postulation about the first 12 weeks of pregnancy. Anything that's like chemicals that you are if you are exposed to some chemicals like fumes and things like that can affect your baby and things like that. Viruses, they said, can affect the babies that can develop schizophrenia later in their years. And also environmental stressors are believed to uh, combine with genetic vulnerability can produce schizophrenia. So those are some of the things that we need to teach more about. Getting pregnant, that's for 3 months. Be very careful, because if you are already have you are already vulnerable genetically, you can produce schizophrenia being exposed to any of those risk factors. What are the symptoms of schizophrenia? How does the patient feel? Because those are symptoms. We have what we call, there are like four major ones, groups that we could talk about, main groups. And also, before I go into that, there are several types of schizophrenia, but I'm not going to go into details of all of them. We have delusional, catatonia, disorganized, and schizoaffective schizophrenia. So as I go on with my weekly discussion, sometimes I will come back to talking about different types of schizophrenia and also in details about medications and treatment. So, okay, now, four main groups of their symptoms. Number one is positive symptoms. It's called positive symptoms. Under positive symptoms are hallucination, seeing things. Could be visual hallucination, that you see things that are not there, or the auditory, like you are hearing voices and things like that. Those are hallucination. Then delusion is a strong held belief about something that is not actually true. So they have different types of hallucination. Persecutory hallucination, they are believing that people are out to get them, people are thinking ill of them, they are planning evil against them and things like that. Then we have another positive symptom is called disorganized speech, like looseness. They have different types of speeches that they have, like they can repeat phrases, and poverty of speech, like when they speak, they stop in the middle of their sentence, they lose track of what they are talking about. Then the other main groups, number two, is negative symptoms. That is when we call, one of them is blunted affect, that when you look at their face, they're flat, they don't have any emotions on their face. Poverty of thoughts, like lows, they don't have any motivation, like they don't have like, oh, I have a goal that I want to achieve. And also they have under negative symptoms, inability to experience joy or pleasure in things. Some of them, things that they used to love, like somebody who used to play football or play music, they are no longer interested in those things. Then the third main group is called cognitive symptoms. Cognitive symptoms has something to do with their brain functioning. They are inattentive, they don't pay attention, they are very easily distracted, impaired memory, they have poor problem solving skills or poor decision making skills, illogical thinking, like some of them can have magical thinking, impaired judgment. That's under cognitive symptoms. And under the affective symptoms is called dysphonia, like they don't have ability to actually show affection to anyone. And also they have suicide ability, like they feel hopelessness. And one big thing that we have to be very careful with schizophrenia is, if they commit, people who attempt suicide, they will carry it through. So we have to be very careful in when they are acutely ill. So, and all these symptoms will affect their ability to work, like in school work, because of the distraction, ability to sustain a job, affect their communication, affect the memory, and also they can't, they are they are not able to focus. So it affects self-care, how they take care of themselves, and also social functioning and also quality of their life. How do we treat schizophrenia? you know they have different phases, like when they are acutely ill, when they are really psychotic, they can't take care of themselves, they will have to be admitted. For all schizophrenia, they have to have medications. Medication is a must for them. So acutely they will have to be admitted to the hospital, and when they are in the hospital we have to be in a structured environment where we have medications for them that are prescribed to help them, to prevent agitation, help them, because it takes up to like 6 weeks to really have full effects of their medication, to change, to balance the brain chemistry in their brain. So milieu management is very important, managing of the environment where they stay, and of course, like I said, medication. And when they are in phase 2 and phase 3, where which is like this, they need long term. One big thing with schizophrenia is just like diabetes, and that's how I try to explain to people who have schizophrenia. If you have diabetes, there's no cure for it. It's a long term, it's a chronic disease. Same is schizophrenia. It's a long term care, and we rely, in order for a patient to be successful, need for big approach for them to be when they are in phase 2 and phase 3. Their medication, that's number one. One big thing with people with schizophrenia is they don't believe they are actually sick, they are actually ill. So when you don't feel like you are sick, you don't feel the need to take medications. But a lot of them, when they are psychotic or they are brought to the hospital and they have to be given medication by force, which we have to another you know they have to go to court to get an order to force medications on them unless we give them in an emergency. Another thing is another approach is treatment adherence. Keeping them on in line in their medication. Because, like I said, a lot of people with schizophrenia fall off the wagon, stop taking their medication because of the side effects of because some of the side effects can affect their libido and all those things, weight gain, and can push them into, especially the new generation antipsychotic, and also even the old generation, because I will have time to talk about there are different types of medication. We have what we call the old generation, the typical antipsychotic, and we have the new one, atypical antipsychotics. The atypical the new ones have less side effect. That's why we prefer those ones right now, unless the patient is already taking the old generation ones and the patient has positive responses to those ones. So teaching is very, very important. Educating the patient about the side effects, what to expect, and if they have untoward side effect, not to stop taking their medication, but to call their primary doctor, call their psychiatrist, and get something. We can switch it to something else. And also their type of medication that they take could be tablet, could be injection, and we have monthly, and also now we have medications, injection that are like once every 3 months, although all these medications are very, very expensive. Also, the treatment relationship with trusted care providers and support people, like case management. They have to have a case manager, because this problem starts when these patients are getting into adulthood. So, and they don't have a job, they don't have insurance, so they have to be plugged into the system to have SSI and Social Security, so that they can have some means of paying for their medication. And the first, community-based therapeutic services, like when they are discharged from the hospital, they need to be at attached to a community-based services, like where they go, they will receive their medications, where they will have to go to therapy to see a psychologist in addition to psychiatrists that prescribe the medication, because the therapist and counseling helps them to develop better ways to recognize and handle problems. They have problems with problem solving. When they go to counseling, they can develop ways to manage and handle their problems. Also, how to manage their behavior and their thoughts, their thinking. Also, it can also help them to improve how to relate to others. So, therapy is very important and inclusive in the management of schizophrenia. Like I said, I'll stop here because I don't want my videos to be too long. In future, I'm going to talk more about schizophrenia. We'll probably break it into parts then. Thank you. With next week, I'll probably talk about personality disorders.